World Teen Mental Wellness Day. Physicians look at specific criteria in order to determine if a person has a mental illness. For a person to be diagnosed with major depressive disorder, physicians generally look for depressed mood or lack of interest in hobbies or recreational activities. However, in a teen, these signs might show up as changes in their grades, a disinterest in friends, or out-of-character irritability. If at least one of those symptoms is present, additional criteria are assessed. We produce 5 amazing videos per week on various topics, so please click on the like button and subscribe to see future videos. Like, comment, share, subscribe. Additionally, 5 out of the following 7 symptoms are required for diagnosis: changes in sleep, new onset of guilt, changes in energy level, changes in concentration or task completion, changes in appetite, changes in motivation, thoughts of suicide. The most common mental illnesses in teens are generalized anxiety, excessive worry about everyday matters, social phobias, severe feelings of self-consciousness and insecurity in social settings, depression, persistent feelings of sadness, anxiety, and/or emptiness. More than 1 in 10 children between 12 and 17 years old experienced an episode of major depression in 2014. That means for at least 2 weeks, the teen was depressed or lost interest or pleasure in other activities, could not function normally, having trouble with things like sleep, energy, or concentration. Social media can be a blessing and a curse for teens and adults alike. In recent years, there has been growing concern about the effects of social media on the developing brains of teens. Research indicates there is a strong link between heavy social media use and teen mental health problems. Online social media sites such as Facebook, Instagram, and Snapchat can inadvertently put undue pressure on teens by putting forth unattainable body images, status symbols, or other successes attainable by only a select few. Underdeveloped coping skills. Many teens have not developed the coping skills necessary to effectively handle triggering events or unpleasant situations that life can present. Maladaptive coping skills such as overeating, consuming too much social media, or engaging in other risky behaviors such as alcohol and drug abuse can lead to mental health illness if proper responses or triggers are not developed. Relationship difficulties. Teen relationships, be they friendships or romantic relationships, are often weighed down by stressors that can either produce or aggravate adverse mental health symptoms. Due to their nature, teen relationships are ever-changing and lack of adequate coping skills needed to handle the emotional disruptions that come from the dissolution of a teen relationship, especially a romantic one, can often result in symptoms of teen depression or anxiety. Unfortunately, it is not uncommon for the mental health symptoms that arise from some of the factors mentioned to be written off as ordinary everyday mood swings attributable to adolescent development. It is essential to look deeper into the cause of the behavioral or emotional changes a teen may be experiencing to determine if their symptoms could be indicative of something more profound. Depression. Major depression affects everyone differently. However, it is typically marked by overwhelming and pervasive feelings of sadness, which can impair one's ability to concentrate or engage in everyday activities. Recent data shows in excess of 11% of adolescents and teens report experiencing at least one major depressive episode within the last year. Anxiety. Anxiety disorders are common among teens. Approximately 1 in 3 teens meet the criteria outlined in the Diagnostic and Statistical Manual of Mental Health Disorders by the time they reach age 18. There are several types of anxiety disorders, but phobias and separation disorders are those seen most often. Like depression, anxiety disorders are most common in females than males. Eating disorders. The most common eating disorders seen in teens ages 13 to 18 are anorexia, bulimia, binge eating disorder. Although adolescent girls are at a higher risk, almost 3% of teens will be diagnosed with an eating disorder. Depending on the severity of the disorder, treatment is essential as life-threatening medical conditions can result.